We can't imagine going forward without that.
Great. So what do you feel is the best way to message the public health community, policymakers, and individuals around these issues of gender disparity?
Well, we certainly always need better science, better investigation, more knowledge in order to address those kinds of things. And the public health community and policymakers, I believe, understand this, and those who don't will very shortly understand that we have to highlight what makes a difference and how do we address those differences.
Great.
Have you guys happened to see certain policymakers or others, or maybe even just like caucuses or in general through the legislative body, like certain areas of opportunity that maybe us on the advocacy side could be able to influence that maybe you all from the government perspective haven't been able to typically hit? If you can't answer, I understand. I'm just trying to think of like, some...
That's an interesting question.
Well, but that issue, it came up today. I can't remember who made that statement, but the need to have better outreach with legislation, with funding, et cetera, et cetera. And I know the advisory committee, when they met in January and February, suggested also that we needed to, not we the federal government, but the healthy people stakeholders needed to be involved legislatively. So that idea is not new, and it's one that has circulated, and it's been a weakness that's been pointed out. So.
I think another partner that is becoming a much bigger piece of this is, for instance, the African American Church is a venue for working on health issues. And I think those kinds of partnerships are very, very important. We can't just assume that we are reaching men. We need to go and explore all kinds of partnerships. And of course, your work with women working for more prostate awareness and less death and morbidity from prostate cancer is a good example.
Yeah, we've definitely, our organization, both of our organizations have definitely been reaching out to the African American church population, so we hope to do more of that in the future, definitely.
And other faith-based organizations as well.
I liked what you said about reaching out to men where they work, where they play, and where they pray.
Yep, you got it.
That's, and maybe those communication channels, even slogans like that hit people where they live and they remember it. And I think that's so important that we use those channels when we've got them. The church, it's a waste of money when we don't do that.
Right. One of the challenges for us that's always come up when we've looked to, the program that Teresa was referencing is called our Healthy Sunday Initiative. We're trying to get in there with the African American Church and other churches and denominations to approach this issue. Do you guys know, and I know it's an issue that came up today through public comment, was finding the funding and the resources to be able to do those types of things, to bring our messages down into those areas. Are there outlets that maybe we're not familiar with, or recommendations for other organizations like ours that are looking to do this?
Well, we actually have, there are resources, I'm sure, but I want to tell you about something we have planned for 2020 that ties into that. We have an R&D project that's underway in the Office of Disease Prevention Health Promotion that's looking at creating a shared workspace on the internet that once the Healthy People 2020 objectives are completed, they'll be posted on that internet, but it'll also be a tool. It'll be a health planning tool, a place to find resources, a place to post what you're doing. The Men's Health Network could post their plans, but the way we envision this is that a user like yourselves would go on to the website, they'd plug in what their needs are, what their health needs are, and the website would have a database of the objectives. The objectives would be spit out that would be important to you, and then you could take it a step further and say, well, great, what are best practices for achieving these objectives? And you could say, okay, well, now I need to know what resources are available. So we're working on building a compilation of resources. And then you could take it a step further and say, well, who else is working out there on these objectives? Who can we partner with? So we realized that there are resources out there, but we haven't put them in one place, and that's what we're trying to do. So that should be very exciting when we're done.
And
so.
others can add to the database.
Exactly.
Wow.
And it'll be, it's a grand plan, and we're working on it. So hopefully we'll have a place where we can send you with all the resources.
That sounds amazing. I think that would be a great help to organizations like us.
Absolutely.
Well, we're trying to improve 2020. We've always put, as we said during the meeting, each decade we've published a list of objectives with baselines and targets, and we said, here you go. Go achieve those targets. And now what we're trying to do is go a step further and provide strategies for getting there and better resources.
Excellent.
So.
Thank you for that. That's great.
Well, you guys, we mentioned the Healthy Sunday program, but what else can organizations like Women Against Prostate Cancer and Men's Health Network do to help in this gender disparity issue?
Well, you all are certainly making progress, and we congratulate you on that. But attending meetings like this, identifying expert consultants that can represent you across the board, and get back to you with information that they learn and collaborate with you, I think, is one way. Staying very involved in the process and identifying expert consultants. Maybe you are the expert consultant for your organization. Certainly from your questions you sound like experts to us. And so I think that's one important thing you can do.
And stay in touch. I mean, continue to visit the different agencies and offices that you need to work with, and to keep us focused, because we have a lot to focus on, and we need that reminder every once in a while that what issues are important.
I just want to back up what Penny was saying. You tend to think of the federal government as having the power to regulate things to make them happen, but you really can't regulate personal choice. And I think the ability to educate people is probably the most important skill that we have, and the most important skill that we can get other state and local health departments to use. So the fact that you do have experts who are getting out there and talking to people and motivating them is so important, because that has a ripple effect.